I knew pretty early on in medical school that I wanted to do primary care. I get to teach residents, I get to teach medical students, I get to have my own continuity patients, I get to do research. It truly is full spectrum medicine.
Some of my first kind of career aspirations were to be like a high school biology teacher and / baseball coach. So that's always kind of been a part of who I am and what I like, and so coming to a faculty, more of a teaching position, felt natural that way.
I think every teacher has an interest and a passion for seeing a student or a resident take shape over a period of years over their training, and then get ready to sort of go out into the world and practice on their own, and it's really neat to watch.
I actually have a lot of conversations with residents that are thinking about going into academic medicine and just trying to weigh the pros and cons. There's a lot of issues that go into this very big, important decision. Certainly at an academic center, there's this kind of notion that you're going to make less money. And I think there's also some concern that having learners in your clinic can slow you down, that you can't see as many patients.
One of the things that I thought about a lot was what kind of flexibility my schedule would afford me as a private practice doc versus a faculty person. I have 2 young children, and I want to be able to do everything with my family that I feel is important. And there's a lot of administration. There can be some bureaucracy, some red tape. Other things you think about are I hate to say it, but money, loan repayment is obviously something that a lot of medical students think about, a lot of residents think about or choose not to think about for 3 years while we do residency and defer all that money. I think it's generally accepted that you're going to make a little bit more money if you choose more of a private practice model versus a faculty position.
I kind of thought that having some kind of STFM workshop would be really helpful, someplace where we could go maybe a day or so before the conference and just meet other young faculty and kind of figure out what is being done at other places, what's working there, and different things that we can share ideas. I think having online modules that can teach new faculty how to teach, because we spend so much time learning how to be doctors that not a lot of time figuring out how to teach medical students and residents.
You get a little bit of training on how to teach and education theory in general and residency, but not a lot. Kind of further development in that area, specifically about what it means to be a good teacher, how to get the best out of folks.
I think it would have been helpful to have people who are a part of the different careers that I was considering to get some sort of context and some background to kind of help make that decision, because there's really a lot of things that you think about, not just in terms of your job and your workplace, but also the environment in which you're going to be working and living.
Yes, dedicated, enthusiastic faculty are so critically important to the future of our departments and our residency programs, and most importantly, to ensure quality care and access for our patients. And young faculty such as these you have just seen are very important role models of excellent patient-centered care for our learners. Yes, there's a tremendous need for family physicians in this country, and that means a tremendous need to continuously recruit faculty. And STFM has recognized the importance of this, and that's why it's launching this new initiative, Faculty for Tomorrow, to address some of these needs. Your STFM Foundation is also very pleased to have an important role in the Faculty for Tomorrow campaign, as we have pledged our support in raising money to fund this initiative. Yes, this is new territory for us. We have never launched a campaign above and beyond the annual membership giving campaign, nor have we ever gone out to outside donors as we hope to do this time. Perhaps you have caught on to my not-so-subtle message of yes and. But to keep that in mind is so important to the success of this initiative and to STFM and your foundation. We need you to say yes to giving to this specially targeted campaign for Faculty for Tomorrow, and we need to continue to be generous donors to the STFM Foundation. So please join with your colleagues across the country in saying yes and.